Hello.
Hello, Bob Cobb here.
There we go. Can you hear me, Rhonda?
Yes, I can.
All right. Can you see me?
Who's talking to me?
Shannon, sorry.
Shannon, no, I cannot see you.
That's interesting.
So I'm just getting everyone on, making sure. I just moved some people up to panelists who will be speaking tonight.
Rhonda?
Yes.
So Sid and Karen are going to join to talk about services in that area.
Thank you. So I'll add Karen up. And let's see. I'll move all the West County people up into panelist mode. Okay. And I'm unmuting everyone, so you can mute if you need to. And I'll do my best to monitor with everyone to help out for speaking, hopefully.
Ron, we're all muted now.
All right, still have people trying to get on.
Okay, I'm going to go ahead and start. The beginning of the meeting is a lot of, just talking, me talking. So I'm going to go ahead and do that part. So this is the County Mental Health Board meeting, and it's being held virtually with a concentration on Guerneville and West County issues. I'm going to read a couple of things that tell about the Mental Health Board. So the Mental Health Board, who we are. The County Mental Health Board, Sonoma County Mental Health Board, is an advisory board empowered to listen to the concerns of our constituents and to help formulate policies that offer a consistent continuum of care for all of those with mental health challenges. We are further empowered to advise the County Board of Supervisors on the mental health system of care. The Mental Health Board mission. The Mental Health Board acts as a community focal point for mental health issues and advocates for the development of a community network to promote the following: coalition building that will create a unified voice to impact public policy and awareness, a wider understanding and knowledge of mental health issues, the integrity of mental health services, involvement of clients and families in mental health planning. The Mental Health Board vision. The Sonoma County Mental Health Board collaborates with the Mental Health Services Division of the Sonoma County Department of Health Services to increase public and professional awareness of persons with mental health challenges and to help eliminate the stigma attached to those mental illnesses. We strive to positively impact the mental health system by listening to public input and working with mental health services to create policy that will offer hope to families and individuals living with mental illness. Okay, so I'm going to do the roll call. Patricia Gray. Peterson Pierre. Betsy Chavez.
Here.
Fran Adams. Here. Carol West.
Yeah.
Marianne Swanson. Becky Ennis. Michael Johnson.
Here.
Welcome. Your first official meeting. There's a vacancy in the 3rd district as well. Bob Cobb.
Here.
Peter McElweeny.
Here.
Shannon Barton Wren.
Here.
Welcome.
Thank
It's your
you.
first official meeting too.
Oh,
Robert Hales,
Here.
myself, Kathy Smith, and Sherry Wires. Okay. So according to my notes, we have the approval. We need to approve minutes for June 17th, and those minutes have been posted. And according to my records, we don't have an approval for the MHSA meetings hearing as well. So those two meetings we need to approve the minutes for. So do I hear a motion to approve the June 17th minutes?
So
So moved.
Okay, I'm not sure who that was, but thank you.
Right.
Okay, Peter moved, and a second?
Second.
Okay, Bob Hale second. All in favor?
Aye.
Aye.
Those opposed? Abstentions? Okay, so that would,
It's me. Fran, I'm abstaining because I wasn't there.
okay, thank you, Fran. And then the MHSA, the public hearing. I know that it was posted. I don't know if everybody has had a chance to read it. I'm hoping you have. So is there a motion to approve that? The minutes for the MHSA hearing?
I make a motion to approve.
Okay, Carol, and is there a second?
Oh, second.
I think that was Sherry that,
Yeah, I made the motion to approve.
Oh, Sherry made the motion, and the second was
Bob Cobb.
Bob Cobb. Okay, Thank you. All in favor of approving those minutes? Say aye.
Yeah.
Opposed? Abstentions?
Abstaining, Peter.
Peter McElhinney's abstaining. Okay, so those are also approved.
Becky's on now, Becky Ennis.
Okay, welcome, Becky. Okay, so Consumer Affairs Report. Kate? You have to unmute, Kate.
Thank you for that.
Uh-huh.
Hi, everybody. It's nice to see everybody's face. Tonight, we're going to have Carol West talk a little bit about the Sonoma County Peer Council. So I'm going to turn it over to Carol.
Yeah, hi. So the Sonoma County Peer Council came into being about November of 2019, so it's relatively new. And the impetus for that was the experience that we had as a peer community around the budget cuts and the need to be organized and to have a timely response to budget hearings. The outcome from last year was a good one. We ultimately, we initially lost 100% of our MSHA funding, and our particular program was 100% funded by MSHA funding. So the outcome was that we got Board of Supervisors general funds to bridge us to our current position, which is a happy position. There was a new RFP that was taken up by West County Services, Community Services. So that's also a interesting that that's who's speaking tonight as well. What we realized was that there was a need for us to be able to communicate with people with lived experience. And I say peers in the most general form. It's anyone with a who self-identifies as someone who's struggled with in the past or currently struggles with a mental health issue. And we also are very welcoming of anyone who is a support person. So that's a family member, a relative, a neighbor, a mentor, an ally, because we really believe that it's going to take all of us to come up with solutions that are creative, especially with potential budgets cuts coming up ahead of us. But other than issues of funding, what we really wanted to see ultimately was peers being mentored into positions of leadership and giving the training that they need and the kind of personal mentoring to be able to step up into positions like a mental health board position or a steering committee position. So lifelong learning and collaborative problem solving has been one of our aims. So ultimately, the reason for wanting to be in positions of leadership is that our experience was that if we're not at the table, we're what's for lunch. And I think that other people have experienced that in the past as well. And our vision is a world in which inherent worth and dignity of every person is valued and respected. So really integrating people with mental health challenges as part of the normal population of any community. And our mission is to work together towards mental health parity. So I won't take up too much time because I think we have a lot of other presenters, but we do have a website. And I encourage you to visit our website. It's just Sonoma County Peer Council. We have a Facebook page, and if you'd like to hear more from us, you can sign up for our monthly email letter. And we do a once a month listening circle where we take a question and people have an opportunity to share their opinions on that topic. Tomorrow is in fact our July meeting, or not tomorrow, Friday, July 24th. And our topic is with potential budget cuts on the horizon, how do we build a robust and meaningful community participatory process? And that is a Mental Health Service Act requirement. And the Mental Health Service Act staff have been very supportive in moving to the next step of how to implement a process that really creates opportunities for input on an ongoing basis, and that we don't have to wait for a crisis to be able to give input. And our guest speaker on Friday will also be Susan Keller, talking about advanced care directives as it pertains to people with mental illness. So if you have a mental health crisis, you know, who do you want to call? What do you want to happen to your supplies, your apartment, your dog, those kind of things. So our guest speaker will be Susan Keller. And ultimately, really, it's borrowing from the disability rights movement that's saying nothing about us without us. So that's our intention. So I'll answer any questions if you have. Otherwise, I encourage you to come to a listening circle or visit our website or Facebook.
Does anybody have questions for Carol?
Comment sounds fantastic. Thank you.
Yes, thank you for spearheading that, Carol. Okay, so we are now at a time for public comment. If there are public comments, and we'll limit your time to 3 minutes, but this is an opportunity if there are people that have comments that they would like to make. Just make sure there's nothing in the chats. Okay. Okay, so now it's time for our presentation, which this month is local Guerneville and West County issues. And I know that West County Community Services has planned to speak, and I also see that there are several people from the county that may want to chime in on what's happening out here. This is my district and Sherry's district. Sherry is in Sebastopol and Bob Hales is in Detroit. So we have this, you know, kind of the corners of this district. Don't have Roseland, but there we are. Okay, so I think we will start with West County Community Services, and then we'll go. Sid, would you like to speak at some point?
Sure, that would be fine.
Okay, and Karen, were you wanting to speak at some point? You're muted. Okay, and then there was somebody from the health center. I'm not sure who that is. Okay, and is that Linnea or? Okay, Linnea. Okay, so Sid, Karen, Linnea, and Tim and Christy. Okay, so I'm just going to say, Tim, start.
Well, thank you. Thank you to the chair and to everyone there. I'll speak very briefly as Christy is much more knowledgeable and is directing the programs. First, I want to say two things. First, how excited we are to now be working with the people formerly with Goodwill at the Wellness Center, Interlink, and Petaluma Peer Recovery. I had a chance to meet everybody at the introductions that we did about a month ago, and we're really proud to be teammates with them moving forward. So to everybody on the call, thank you, and we look forward to it. And secondly, I just wanted to talk about something that's very lower Russian River, but non-traditional, if you will. Mental health is, we're going to be, our shelter is still open from the winter. It was supposed to close March 31st. It's been extended due to COVID. We have a great partnership with West County Health Centers where their behavioral health people and their nurse come in and work with our shared clients. And we're going to be transitioning outside to a COVID navigation center in Guerneville on or about August 1st. That's another great partnership with the health center and with the county. And we'll continue to provide mental health services to our clients out there as well. That's it for me, Kathy.
Okay. So, Christy?
Yes. Well, thank you. Thank you very much for giving me some time. I didn't really prepare a bunch of issues. I prepared some information about what we are able to provide right now during this COVID time to our community. And so we have youth and family services still running, adult services, and senior services. And we've been able to take all of our counseling and behavioral health programs online in some way, whether it's telehealth or through social media or Zoom meetings and support groups and classes. And so for our youth and family, we have we're at Park Village offering family and youth services. We have a little mini adventures program running there where we're taking kids from 14 to 19 out on some mini adventures. So this week they went horseback riding, and last week they went bowling and made pizzas, and so they're able to still have some sort of normalcy, and also get out into our community and experience things that they normally wouldn't be able to. And that counselor's also offering families up in Guerneville and in Sebastopol SOS application support, and some immediate financial support that we have available. Our schools are out, but our school counselors are out, but we're working on now again a remote service offering for parents and teachers and students for mental health services and support. Our adult services, we have the 6 new peer programs, and we're just working really hard at bringing services online. So groups through Zoom, social media engagements, and they have been meeting people in person at the sites outside, taking warm line calls Monday through Friday. And so just meeting our community as much as we can in the way that we can right now. Our Hope Sonoma program still running through September and offering businesses support and individual support. We have a Saturday support discussion group that runs through Zoom. And we have our 2 senior programs, our senior peer counseling, which offers up to 12 sessions, telehealth right now, of course, or through Zoom, and then our clinical program where we have 3 licensed MFTs and 3 associates that are offering up to 10 by phone or by Zoom meetings. And then we've also, through the senior program, because we recognize that it's such an isolating time for them, we are also reaching out to past clients for just check-ins and to kind of bridge that isolation gap. So that's what we've been offering, and we continue to build more robust online and telehealth services.
Kathy, you're on mute.
There.
Got better.
Anybody have Questions for Tim or Christy?
Does anybody feel like that the online is working as well for your clients or our people? I mean, I just wonder whether it's how well is it working? I know we don't have any choice, but
Yeah, I think that's it. We don't have any choice, and so no, it's not ideal. But it does help, like I said, bridge that gap of isolation. And I think the Zoom, when you can see somebody's face, that helps more than the telehealth. I think another piece is that it comes down to the time and the clinician or the member, whoever's interacting with the community member, their ability to build rapport and just express empathy and be compassionate in these really hard times.
Christy, do you provide, if someone becomes infected with COVID-19 and they're at home, do you continue services by telemedicine for them?
Oh yeah, yeah. I mean, as long as they're well enough, if it's not, if they're able to engage, yes.
That's great.
So I don't know, it may be that Linnea is going to address it, but I have heard that there is, you have the shelter, the homeless shelter, but there's also outreach of some sort to those who are not in the shelter and who are out.
Yeah, so
there kind of in the bushes.
yeah, the peer program, our empowerment center, which is located in Monterey, the program manager has been going to the shelter every evening and meeting people there in person, and then we also have our peer outreach worker who's through the whole person care program. We have two now. We had Arnie, who works out of Guerneville, and he's working Monday through Friday, and he'll be helping support the navigation center at the Park and Ride. And then our new one, who actually is new to us because Miller was with us for a long time at the Empowerment Center. She's in Santa Rosa working as the whole person care peer outreach worker. And then also we have Eric Bohem, who is the peer outreach worker for the MST team. And so he is making, we're trying to build a relationship with the probation department so that he can connect with people that have been recently released from jail, the crisis support unit, and being able to make connections with people and offer support.
Okay, thank you.
Mm-hmm.
Any other questions?
I just want to have a comment. I just want to say thanks for the just dedication to having this transfer happen so well. I mean, I'm really pleased that we're all here and it seems like that, it is all transferred easily and on time, and I don't know how easily. I'm sure there was behind the scenes stuff, but the dedication to make that happen, I'm really grateful for that. So thank you.
Thank you.
Okay. I think that Linnea, maybe you have something that coordinates with what they're doing. So at West County. So why don't you go ahead and go next?
Yeah, thank you. For those who I haven't met yet, I'm Linnea, and I'm currently one of the Associate Behavioral Health Directors at the West County Health Centers. And I do have a lot to say that just the collaboration that we're doing with West County Community Services has been really strong, especially around behavioral health. And you mentioned a question about additional outreach, and in addition to what Christy mentioned, our health team is going to each of the encampments and the West County shelter location to check on people's symptoms, and our social worker, our clinical social worker, has been able to join that as well. And that's sort of an expansion of services to what we were doing sort of pre-COVID, to make sure that we're encouraging folks to be able to stay where they are and not have to move around to get our services. And we're also able to provide, COVID-related medical, testing and care and things like that as needed. And then we're also doing, in addition to, I'm going to say this a lot, in addition to what West County Community Services is doing, we're working together with the school district to make sure that, that mental health services are accessible to students, parents, teachers, and staff, and particularly around, I don't know if everyone's aware of the young boy who passed away in May, who was a student of the Guerneville schools. And so our team was able to really collaborate with the school district around mental health support to anyone who was in need of that. And we, at that point, had to do it all virtually, and will continue to be available for that as time moves forward. And all of our behavioral health for the entire West County has pivoted to online, either by video or by phone. And as you know, the question that came up earlier, is it actually, benefiting anybody? I think the folks who are benefiting the most are the folks who, because of transportation challenges or financial challenges, have trouble getting to a location, and those folks are having an easier time accessing our services. And for that reason, we're hoping that we can continue an element of telehealth beyond COVID. We're all very excited to return to in-person visits as soon as we are safely able to do so, but that's probably going to be a while. And so until then, we're happy to connect with people in the way that we're able. And we're noticing that people are really showing up for this service, even more so than before. I think that that's a combination of the fact that they don't have to go anywhere. So when I call them, they're right there by their phone. And it's so they don't miss the appointment. And then also there's, the increased stress that we're all feeling, which creates the need for extra support. Also, in addition to what West County Community Services is doing, and actually in very specific collaboration with them, we're doing some specific outreach to folks over the age of 65 who also have depression, doing some specific behavioral health intake work and treatment planning work, and case management for that smaller population of folks in the West County area, and that's been going really well. We're doing the clinical work, and West County Community Services is providing the case management and follow-up support, and we're working together as a seamless team. So if you were to interact with somebody on that team, you wouldn't actually know who comes from who. We're working very closely together. So that's been really lovely, and I think that's all my updates.
I have a question about the, you said that you're going out to the homeless encampments, yeah, but there are people that that don't have good phone and internet connection. And is there some sort of outreach that you're doing for them?
So for the folks who are housed, I'm assuming, because the folks who are unhoused, we're just showing up and we're safely with our protective, personal protective equipment and, all the things. For the folks who are housed, we're actually in the middle of problem solving that, recognizing that, our sort of COVID way of life is going to be a little bit longer than a few months. So making sure that we are not leaving anybody out who's in need of services. So we've actually just recently done a quick assessment of all of our panels, our behavioral health panels, from the past several months, starting before COVID, to see if there's anybody who's been lost to care, so that we can make sure to reconnect if, telephone or internet is the barrier to returning to care. We do have some folks who are like not interested in what we have to offer right now and want to wait, which is fine. But it is important to us that we're not losing connection with folks who could use it, who just don't have the resources.
Kathy, do you mind also if I share? Arnie has been equipped with an iPad, and Miller and Arnie both have smartphones. So when they're out meeting people that are unhoused, they can, and they've got all the protective stuff as far as like sanitizing and stuff, but they use their phones to help them make phone calls and to access internet if there's something they're looking for. They need to sign up for a new CalFresh card or something that they lost. So they have those devices to use while they're out.
And I'll quickly note, Clean River Alliance has been trained and now has the second iPad and is doing the same.
Okay, and Clean River Alliance makes, for those who don't know, makes contact how? What is their role?
They're managing garbage pickups with homeless encampments, and when they drop off bags for the homeless themselves to pick up garbage, they pick up the filled garbage bags already, and they're doing the COVID screening on site while they're there.
Okay. Any questions for any of those three?
I have a question, and I apologize if this has been mentioned in previous meetings, but for those of you who are on this call that work with our homeless population, how many of you attended the trauma-informed care training that was offered through Intersections? I'm trying to gauge, because I know that the trainings have been offered already and the funding is pretty much it's gone, but I wonder if there's an opportunity for more funding to come in and to continue the training, how many of you have or have not, just to see if there's interest.
Sure. So I did not attend that training, but have been in the trainings put on by the National Healthcare for the Homeless Council. And so feel like I've accessed that material specifically just in a different venue. And I'm certainly interested in supporting more folks to have access to that that curriculum if it's needed. Certainly an important topic.
Yeah, this was offered for those that are working specifically with our homeless population, service providers. And yeah, definitely something that I found much interest while even on the CDC and engaging folks to take part in the training. So now that I'm on this board, I'm interested to see who else is out there and who else we need to engage.
Yeah, I think that's great. And I think some of us on this call could probably support to provide some of that training if grant funding is not accessible.
Okay. Sid, would you like to speak to what the county's doing?
Sure. Our primary activities are for folks who are enrolled in our services. We still have a case manager working full-time in Guerneville and the West County area. Our psychiatrist is still working. He's doing telephone and telehealth work. We have a nurse who, if there's anybody who needs medication support services, he's running around doing home visits. And I think that's it. We have a case manager. We also have a clinician who is supporting the case manager as well. And the case manager is also doing primarily phone, but also home visits, when needed, or going out into the community. We're not doing office-based visits at this time. And then of course we have our collaboration with Whole Person Care. We have staff going out several times a week, working in conjunction with the peer provider with West County Community Services, to do outreach and engagement for services. And just to let everyone know, we have a new program manager for the whole person care team. Her name is Desiree Olstrom, and she was sorry she couldn't be here tonight, but she will come to a board meeting just so that she can show her face and let folks know who she is. And that's about it.
Okay. Any questions for Sid? Thank you for being here, Sid.
You bet.
Yeah. Karen? Did you want to?
Can I say one more thing?
Sure.
I also wanted to piggyback on what Erica said, just to say that I'm just so grateful for West County Community Services and the ease with which we were able to transition all of our peer services to under their umbrella. I mean, it was really just they're just extraordinary to work with. So I just wanted to say that.
Okay. Thank you. Karen?
Hello, everyone. I am here to say just a few words about Mobile Support Team, which does work in West County. We work with the Sheriff's Office and with the Sebastopol Police Department, covering as much of the West County as we can. And in addition to providing our response out in the field with law enforcement, we also work with our wonderful peer partners to provide peer support, and with NAMI to provide family support. So in addition to doing the crisis response in the moment, when we interact with folks who want additional peer or family support services, we will connect them so that they can proactively reach out and get people involved in those support services as well. We work closely with our treatment teams, letting the teams know if we come across someone who's open to a treatment team that they may need some additional support, or getting people connected to services if they're not already. And we do particularly work closely with whole person care to get people connected to those services as well. I feel like most people on this call know quite a bit about MST already, so I don't necessarily want to go through the whole song and dance, but I'm happy to answer questions if people want more information about Mobile Support Team and what we do.
So a comment about Mobile Support Team. I don't know, were you on the call? Were you a part of the meeting last month where Supervisor Gore, yeah, where Supervisor Gore was participating?
No, I was not.
The Mobile Support Team was a major part of that discussion and that meeting. And a compliment to the Mobile Support Team really was that they really, really want you in North County. And
we really want to be there.
Yeah, Supervisor Gore was really, really making that point. So compliment to what you're doing, but you know, that was definitely a big part of that meeting. So
well, thank you for passing that on.
Yeah, yeah. I want to comment that I am really impressed with the way that all of you keep mentioning how you're working with each other, and it sounds like the services are really it sounds like a team, and with different organizations being involved, that's not always the case. That it sounds like teamwork, and it really does. So I'm really happy to hear that. Did anybody else have questions for anybody who has presented?
I just have a comment too, Kathy. I just really thank you all for your dedication, and for me, it does my heart good to hear how far-reaching the services are in that remote part of our county, because I know it can be difficult to get to everybody, but it seems like you're getting to a lot more people than past history shows us. So I just thank you so much for keeping on, keeping on.
I am curious since, I mean, this is District 5, is West County. It's also Roseland. So at some point I'm trying kind of to figure out
right
what's happening there. So, you know, it's probably not a discussion for right now, but it's definitely a discussion that we have to have. So, have to figure that one out. And it's kind of ironic that the whole behavioral health team is pretty much based in that area. So, so I'm sure that there are some services being provided there because that's where behavioral health is based. But I think that's one of the, it's an area where there's a large, what is the right term, Latinx presence. And I'm not sure exactly what's happening for them. So
sounds like a topic.
A topic that we need to address. Yes. Yes. Okay. Any more questions for any of the presenters?
I have one, please.
Oh, yes.
I'm not sure who would field the question, but for isolated seniors who are not already connected to various senior services or whatever in West County, what is the outreach process to try to find folks who are not presently connected, as seniors specifically?
Would somebody like to respond to that?
I mean, I could give a limited response. I mean, our only reach can be to people that we have seen at some point. Otherwise, it's through APS or home health services that are still able to provide services. Potentially senior service or senior centers that are offering meals where people can come pick up. And then case managers are on site. Yeah, I mean, for people that are truly isolated in their homes, if they haven't received services in the past, there really isn't a way to reach them that I can think of off the top of my head. But we are constantly talking about how can we meet our community.
Christy, is there any connection to the doctors, to, you know, geriatric care doctors or even GPs who realize that there's a need?
The doctors themselves would have to receive it or, you know, ask for a consent of release in order to in order to give us information for us to contact them, or refer their client to us for services. Then the follow through on that end, if they, you know, provided the referral, the follow through would have to be on the senior side.
I can add to that too for the specific project that West County Community Services and West County Health Centers are doing together for folks over the age of 65 who also have depression. There's already a release in place for those specific individuals. And then the doctors are similarly limited. Somebody has to have entered care somewhere for us to know that they exist. But we do have a wider range of sort of entry points that we're able to work with through the public health department, through the shelter systems and our outreach, as well as somebody just showing up for a doctor's appointment somewhere within our system of care.
Thank you.
Yeah, thank you.
I have a question. Kathy, so I'm wondering how many of your clients, if you do have any clients that are Spanish speaking, and potential providers that are bilingual, and if not, are you collaborating, let's say with Latino service providers or humanidad therapy. I'm just wondering what that looks like on your end.
So for us, we have I think it's three behavioral health clinicians who are fully bilingual and do services between them for all ages. So we've got somebody who specializes in kiddos and then a couple who work with adults. I'm working very hard to be one of those people, but I'm not there yet. And then we use an interpreter line too when we need to. So I've used that for a lot of different languages actually, when especially when there's someone needs something in the moment and for an appointment is inappropriate, we'll use the interpreter line, which is not as therapeutic, but it at least allows for connection. And in terms of the percentage of patients, I think it's pretty low, but we also recognize that our sort of system of care is possibly not fully culturally competent to promote access for as many people as may benefit from our care. So, so we are in conversations on both ends. Who do we have and who are we missing and why are we missing them?
At West County, we have 2 peer providers that are fluent in Spanish. One of our senior, our associate MFTs in our senior program is Spanish speaking. And then also in our Hope Sonoma program, we have a fluent Spanish speaker.
Yeah. Thank you for that, Linnea. I think I agree with you in terms of being culturally competent. It's very important, especially in mental health space. I'd like to support or see how I can make those connections with Latino service providers and humanidad therapy. I think that in having the partnerships with those folks that do have access to the cultural competence piece, to being multicultural, bilingual, is highly important to connect with our families, especially, let's say we have families who are undocumented. You know, what does that mean, and how to best work with our community, especially throughout the fears that we're facing today. So if I can help with that, I'd love to make those connections.
Okay.
Yeah, you guys, just so you know, my understanding from talking to Nubia of Humanidad, that they could potentially do specific trainings for other agencies, that they would be open to doing that. So I've spoke with her about that previously too.
Great, thank you, Erica.
Okay, and I have one comment and then there's a chat that I'll acknowledge. I watched a training today that was suggested by Sid, and I forget the name of it. What was the, do you remember, Sid, what it was? You don't know what you suggested, but I watched it, and it was a program that I will have to remember the name of at some point, but I don't. That was focused on the mental health needs of people of color. And one of the comments they made that I thought was interesting, that I think applies to the conversation that you're having about the Spanish speakers, is that they said one of the advantages that they're seeing for as a result of the COVID-19 and our switch to telemedicine, in large part, is that people who are unable to access services from providers who speak their language or have their color, whatever, are finding that if they don't have access to those services from people that they are comfortable with where they are and in person, that some of them are being more able to reach services that they feel connected with through telemedicine. So maybe that's a bigger collaboration that needs to happen. You know, if you have somebody that you're having difficulty reaching because of a language issue, or they're not comfortable because they're a person of color and you know, you're not, or you're a different color, whatever, that they can connect through telemedicine with somebody that they would feel comfortable with, that they would feel as a peer to. So that's something maybe to kind of put in a basket of thought. It's an interesting point that was made there. Anybody else have a question or comment?
Yeah, Michael here. I had a question for Karen. I'm not too familiar with the mobile access team, and so I was wondering what a call with the sheriff's office looks like for them.
Sure. Mobile support team will respond to any call, with a few very small exceptions that the sheriff's office or any of our law enforcement partners call us out on. Typically, it's a call that they think involves some sort of mental health crisis and or substance use needs. Often it's someone who they think might meet criteria for an involuntary hold, but certainly not always. We end up writing a hold maybe 25 or 30% of the time. So the rest of the time it's individuals who law enforcement thinks would benefit from an assessment of their mental health needs, some additional resources for mental health support. And law enforcement, I think, really realizes that they don't have all of those resources and connections and knowledge that we have. So when they arrive at the call and they determine that we could be of assistance, they'll call us, we go meet them out in the field, we do an assessment, we gather any other collateral information that we can from family members or treatment providers or anyone else who might have input into the situation, and then we decide what the best plan of action will be. And again, when we're not writing a hold, we're doing a lot of safety planning. We're talking with people about what support resources they have available to them. We work a swing shift, so often when we see people, perhaps their traditional service providers are not working. So we do a lot of talking about what things can you do for the rest of the evening or through the weekend, and then who can you get in touch with tomorrow morning or on Monday to get you some additional support. And then after we wrap up the call, we make our referrals to other service providers if that's something that somebody wanted. We make our referrals to family and peer support services, and then we also do a follow-up phone call with everybody that we see, unless they really don't want to talk to us ever again. But we like to check in with people the next day or a few days later and just make sure that they got all the resources that they need and they're getting connected to the support that they need. And if there's additional resources that we can offer at that time, when it's not right in the midst of a crisis, we will try to help get people to additional services or support if needed.
Great, thank you. That was very informative.
You're welcome.
Girl.
Yeah, I just had a quick question. I know that there's a move to get a 988 mental health suicide national line. I was wondering if the mobile support unit has had any discussion about transitioning from a 911 facilitated call, which requires the police to be involved, to potentially moving to a 988 and being able to respond without police, unless it's required to have police for safety reasons, but if that's a possibility for the future.
That's a really good question, and something that's coming up a lot these days, as you can imagine. And we actually, just before shelter in place started, we started a little pilot program in West County, actually, where we would respond directly to the health center without them having to go to law enforcement first. So we're certainly open to that idea. We don't have specific plans right now about that, but it is something that we have talked about over the years, and we're being asked more about these days. And there are other models, both in the state and in other states, of mental health crisis teams that respond separately from law enforcement. I think there's a lot of benefit to that. We would have to, of course, think about the safety aspect, because some of the calls that we go on now would require a law enforcement presence, but some of them wouldn't. So I guess I would say we have no specific plans right now, but it's something that we're open to, and I suspect something that we'll be talking more about in the months to come.
Thank you.
Karen, I have a quick question. Do you provide education to the officers concerning your program, especially new officers, so they know about it, or how does that work?
We do. We participate in the CIT trainings that the division puts on. There's a segment about MST at the CIT training, which we do twice a year when we're allowed to see people in person. We also have done some specific trainings for different law enforcement entities at their request. And we also, again, not something that we're doing right now because we're not getting in small rooms with people, but generally speaking, we do attend briefings with all of our law enforcement partners. And at that time, we usually do little snippets of education about who we are and what we do, what types of calls we can go on, what kinds of services we provide, how we can help law enforcement, how we help the community. So we're always looking for opportunities, either in a larger formal context and just informally, to provide law enforcement with more education about resources and what we do. And we have, over the years, increasingly had individual officers who, after a call, will ask us for feedback about how they did interacting with someone. And that's really one of the things that makes me the happiest, is to actually see law enforcement wanting feedback from the mental health system about how they could talk to someone and have a call go better. So I think a lot of them are wanting that kind of education. It's not just us trying to push it on them.
And Karen, do they routinely, do you give information concerning what happens to the patient, to the officers after the situation ends? Not just those who contact you, but do you contact them?
Information, I'm sorry, about what?
Well, let's say an officer calls you because they think this patient really needs help, and then you get involved, officer leaves, you then give feedback concerning what happened and to educate them.
Do we give feedback to the officers about what happened?
Yes.
Well, that's tricky because we would have to have permission from the individual to talk to law enforcement about what happened after the fact. So it is difficult for us to give them specific feedback about what happened to specific individuals. And they do ask sometimes because they want to know if somebody's okay. So we're more likely to give them general information about what happens with general types of calls. So they know what we do as follow-up, what types of things we do, what outcomes might be, what the resources are, but it's harder for us to give them specific feedback about individuals.
Okay. That's great, Karen. Thank you.
You're welcome.
I forgot to say anything about the chat. So Elizabeth Vermilia said CPI is offering free remote bilingual parenting classes and parent warm line. We're also offering remote therapy and are hiring a bilingual therapist. We're prepared to support West County remotely. We welcome conversations and collaborations. So that was from CPI. And Lupe Navarro said thank you to Betsy for thinking about Latino service providers. We welcome all opportunities to collaborate for the greater impact of our community. This is the time for all to come together and reach marginalized communities. So those are the two chats.
Kathy, could you, for our newer members, could you let us know what CPI is?
It's California Parenting Institute.
Thanks. Just not sure everyone knows all the acronyms.
Right. Okay, any more questions for those who presented?
I have another question for Karen, and it's about what's not clear to me is what happens when someone's having a psychological problem and there's potential for violence. How do you decide who can best deal with that situation, and how do intervention people determine when it's not dangerous anymore?
Well, with our current model, law enforcement is always on the call, and they're always there first before we arrive. And one of the reasons for that is they arrive first and they make sure that it's a safe call for us to come on. So if there are weapons involved, they will not call us to those calls, or at least not until any threat of imminent harm has been addressed. We have at times been called to a call that did involve weapons, and they would tell us, you know, park a couple blocks away, and as soon as we've made sure everything is safe, then we'll call you in. So law enforcement is very mindful that they're really responsible for our safety when they call us out somewhere. So they make sure that things are as safe as they can make them. We certainly get calls to people who may have some violence in their history, or maybe experiencing a crisis that's expressing itself in physically aggressive ways. We got some very clear training from law enforcement when we started this program, and we train all of our new staff about, even before COVID, keeping enough distance between our staff and anyone that we're evaluating, so that if there is some sort of aggression, that we're not in harm's way. Law enforcement, when we're out on calls, they really keep that in mind. So depending on how they think things are going to go, you know, if they think everything is safe and there's really no threat of harm, they try to give us as much space as possible to do our job, so that they're not like hovering over us when we're assessing people, which is awkward. But we have been on calls where law enforcement is standing right next to us, and they will not give us any distance to do our job because they feel like they need to be right there for safety reasons. We've assessed people who have been in handcuffs in the back of a police car because that's what law enforcement felt they needed to do in order to make it safe for us to intervene. So right now, much of that depends on law enforcement's assessment of the situation. And there have been times where we have felt uncomfortable, where law enforcement didn't really appear to be concerned. And if that's the case, we will ask them to step in a little more and provide a little more safety for our staff.
Interesting.
Kathy, I just have a comment. We have so many new members on our board now. Maybe I know they got information about the different programs, but I just would encourage somehow that we get more education on, in other words, what crisis intervention training really is and about, and how many of our officers in Sonoma County have been trained in the different town police departments, as well as the sheriff, as well as Santa Rosa Junior College. You know, I mean, there's a lot of information about that training, and I think the climate of today, it would be helpful for our board members to have an understanding of that as well.
Sherry, I think that would be so useful because I'm not only a new member, but I'm a family member. So I don't have the professional background to understand how all the different systems work together. And it would be,
sorry, I didn't mean to interrupt you, but I think there are links to all this information through our website.
Okay.
And through not, you know, from one area you'll be reading about will give you links to more information, and they'll give you links to more information.
Terrific. Okay, thanks.
Mm-hmm. You're welcome.
Okay.
I just want to say, if we had nothing else to do, we should also train the 911 operators. I had that extremely unfortunate happening of calling 911 for my husband who was altered because of his high calcium from his multiple myeloma. He was a paraplegic, and what I ended up with was the police department in our house to make sure that that was safe. It was so awful to be needing him to get to a hospital and have the 911 operator just not understand what I was saying. But, so sometime when we have nothing else to do, we need to include 911 all of this.
I have a question for Karen.
Okay.
If in the proposals that are being suggested across the country of having the equivalent of mobile support teams go in independent of prior contact with law enforcement, do you see that as a potential risk for the for a team such as yours, for example, if law enforcement has not had some kind of triaging opportunity?
Not really, because I think if we did that, we would be really smart about it. And what we would want to do is we'd want to talk to other teams that already do that about how they do it. There's a program in Oregon that's gotten a lot of press recently. They respond independently of police. In a given year, they had about 20,000 calls, and maybe 400 to 500 of those required the team to call law enforcement in to kind of help them and back them up, which is a pretty small percentage. So I think if something like that is done with a lot of education to whoever's taking the calls to begin with about how to screen for safety and how to determine if a call needs a law enforcement response versus not, I think you could really minimize any risk that there would be. And, you know, I think any crisis type service involves some sort of risk because crisis situations tend to be less controlled and, you know, involve situations where folks are not doing well, they're in crisis. That's why they're crisis calls. Mm-hmm. But I don't think there would be any more risk than, say, our paramedics who go out in the field separately from law enforcement or these other mental health teams that go out separately. We would just need to be smart about it and really do our homework and our research and a lot of training to make sure that we were doing it the right way.
Thank you.
Is it possible that maybe we need to rethink the way, what kind of response we expect from an emergency call, where we expect a team rather than this or that? Because who is assessing where the danger is on a phone call with somebody who's frightened? It would be difficult. And if we just always had more than just law enforcement responding to these kinds of calls, wouldn't that be an improvement?
Carol?
Absolutely.
I just wanted to remind people that NAMI on their website have a pretty extensive resources on how to respond if your loved one's in crisis. And I think maybe Erica, you might Erica Chloe was involved in the development of the materials of how to speak to law enforcement if one of your loved ones is in crisis. And I think that's gone a long way to help communicate exactly what's going on at home before anybody arrives, and help to triage who arrives with what services.
I agree. That was an excellent article that she prepared from NAMI.
Yeah, I just also make the comment that educating of the community at large is as important as educating family members too, because it makes a huge difference when the person calling for help can diffuse any anxiety at the beginning of the call. And you only can do that if you're educated on how to do it. So NAMI is a great resource, and family members are connected with that, and people connected to family members. But my feeling in being in this work for a good number of years is that as has been pointed out recently, our whole community can benefit from understanding better on how to help each other.
So Carol asked if I would talk about the call, the mental health crisis call brochure. So that was a really big group effort. That was actually a 3-year project, if you could imagine that. It was a fun party to go to with a lot of humans. Wendy Wheelwright and I actually spearheaded that because it came out of these kinds of conversations where we were recognizing that there was several different systems coming together and people unable to communicate effectively in a moment of crisis. So it's a tool to help people understand the language and communicate effectively and decrease risk for all parties involved, the family or friends, loved ones, people in crisis, law enforcement, the providers that might come out to the site if it was pre-mobile support team, actually. And so, I think that effective training around communication and understanding access and right level of care is extremely important, and something that all of us are still continuing to work on. And I don't know if there was anything else specifically, but that brochure is on the county website. It's on Buccaloo Family Service Coordination, part of their website. It's also on NAMI. And we've passed it out countless times. And I think last time I counted 7 other counties actually copied that amazing document that we always say we'll share, because it's important that we communicate in a moment of crisis.
Yes, this is Betsy. I have a comment. Thank you, Erica. I think I'm going to sound like a broken record, actually, because when we're talking about having bilingual support, having culturally sensitive personnel to attend to families. So I have a younger brother who has schizophrenia, and I'm pretty well resourced myself. I've actually asked for help by Erica and Katie Swan, and have received support in that sense. But I can tell you that my family does not feel they have the adequate support from services out there, only because they, one, are afraid, they don't speak English very well, and it's very scary for them to think about calling a number and having law enforcement come to your home and that sort of thing. So I'd like to, being on this board, I think I'd like to see how we can expand or provide resources to our service providers like NAMI and LSP and Humanidad, just so that we can get the proper training out there for families that have mental health illnesses among their family members and have different ethnic backgrounds.
I think it's also, to echo what Betsy's saying, is that, and what everybody else was sort of saying, is that it's also, there's there's a step down of support that we could be adding. That it sounds like from what Karen's saying is that there have been conversations about a more preventative model that could step in pre-law enforcement, which definitely I think those conversations should continue and would be supportive if we could engage families and individuals in crisis, whomever that need support prior to having to call law enforcement.
Okay, anything else on this topic? I was wrong. CPI used to be California Parenting Institute, but it's now Child Parent Institute. So that's a correction. And Sean Kelson says that the CAHOOTS model that Karen was speaking of out of Eugene with Whitebird Clinic is a 24/7 available program that has documented great success and immense money savings. So that's the name of the program that Karen was talking about. Okay. Any other comments or questions before we move on? Okay, hearing nothing, I'm going to ask Bill Carter for his report.
Sure. So projects that are priorities right now. One is that, as you may know, the team of folks that have been working with the county to survey the community regarding interest in a quarter-cent sales tax designed to support behavioral health and homeless services. So there's a roadshow out presenting the results of the poll, presenting a proposed expenditure plan outlining the use of these funds and soliciting input from the community. So that's underway. There will be readings of the ballot measure at July board meetings coming up as it progresses towards a decision about whether or not to place that on the ballot. We have been without a medical director since March. We did a good job of improving the salary for the position. The salary is now in a competitive range, but we're coming up against a psychiatrist shortage and the difficulty recruiting people to positions now in the midst of an emergency. We decided to reach out to the locum tenens agencies. So these are agencies that provide doctors, they're like a registry for doctors, so doctors will temporarily work with you. We don't usually go to these agencies for medical director, but we did so, and it was a nice surprise. Apparently, if you are willing to work with psychiatrists virtually right now, there are some very qualified, solid folks out there. So Sid and I did a series of interviews and agreed to invite Daniel Bleman to be an interim medical director. He is currently located in New York. He is relocating to San Francisco, and he has an interest in applying for the permanent position and will be within range to do that. So that was, he had an excellent interview, but that was what tipped us over. So we'll continue our recruitment until our relationship with him progresses, but he'll be here August 24th, beginning to do work virtually as our medical director. The Department Operations Center remains in force, responding to the COVID emergency. In recognition of the fact that we can't run a DOC indefinitely, utilizing county staff who need to go back to do to their standard work, the county is opening a COVID division of public health. So there's work between the department and the Board of Supervisors and the CAO's office. project's been unveiled, it's under development. And while there are no hard timelines in general, we're thinking that that division will be up and running and will take over management of the emergency response at the end of August. Budget. So as I'll repeat what I've said in some of the previous meetings, we go into a tough budget year and we are in the budget process. The budget process was delayed by the Board of Supervisors to allow time to pass that would clarify what's going to happen. So whereas the budget is usually finalized in July, we'll begin discussions in July and they'll look to finish the budget in late August. Good news in the state budget is the state budget offered some backfill for projected losses of realignment revenue. So in the world of behavioral health, there are 3 forms of state funding that are the foundation for our system: 1991 realignment, 2011 realignment, and MHSA. And the realignment, which is vehicle license fee and sales tax driven, was going to be short, and they have backfilled some of that to counties. So the cuts that we will initially have to propose in the budget process will not be as severe as they would have been otherwise. And so we are in the process that we went through last year. The county CAO's office looked at the revenues and gave us a budget target, which includes a reduction. We have to propose a budget that's balanced without any additional help from the county, which is to say we have to do that with division and departmental funds. So we're doing this, and all of the departments are doing this. As the board looks at the budget proposals in session in late July, they'll make decisions about whether or not they have county funds to offer to offset cuts that are proposed by the departments or not. So we have submitted our draft proposals to the board. They will be released at board budget meetings coming up on the 27th and 28th, and there will be discussion about our budget moving forward for fiscal year 2020, 2021. That's my report. Happy to take questions. Yes.
Carol?
If I'm understood correctly, that the budget, the Sonoma County Behavioral Health budget, will be discussed on the 27th and the 28th. Is that at a Board of Supervisors meeting? Is that?
Yes, if you look at the board schedule, you'll see that budget workshops are scheduled for those days.
Thank you.
Any other questions for Bill?
Bill, they haven't given you a target though, have they? In percentage?
They've given me a target. I'm waiting for them to release information to talk to stakeholders about the details. In general, you know, the process I have followed is in previous presentations, I've outlined for you the strategies, the approaches that we have to take as we approach a budget, right? So that is a description of the revenue sources we have, and then a description of the mandates and the requirements we have, and the opportunities we have to grow our program with federal money. And so that's my attempt to give you all a foundation so that you can see what approaches we will be proposing as we have to submit budget projects. As soon as the board has enough information and the process is progressed, we'll release that information and then have the discussions, both at the board meeting and at other public meetings as the decision's being made.
Other questions for Bill? Okay, thank you, Bill, for your report.
There's one question from Lupe Navarro.
Oh,
She's asking, wondering of those organizations funded by MHSA, when will they be notified of the 2020-2021 scope of agreement?
So if the question, if that, excuse me, if that question is whether or not folks who have contracts with the division, when will they know what happens to those contracts? You will know after the board makes a decision regarding our budget. What you will see in the process is the cuts that were proposed. If a contract was in a proposed cut, you will see that, and then you will be a part of the conversation with the board about what they do, and you will be there with the decisions made.
Thank you.
Okay. Any other comments? Erica, did you have something? Okay, you're on.
Thank you. I just really feel the need to acknowledge the racism that was so publicly displayed at the county meeting, at the homeless meeting. I can't remember I can't remember which homeless meeting that was with providers and county staff. I just want to acknowledge that because sorry?
That was the Leadership Council.
Leadership Council. Thank you, Bill. I just feel like it's important that we, just acknowledge that and how challenging this time is currently in our community, and how when people are stressed and scared and we're in our fourth disaster that, more comes out, and it's good for us to actually look at that, but my heart really kind of broke with that. And I think, Betsy's over and over underscored the importance of us having culturally appropriate and, services that fit individuals. And so I just felt like I didn't feel okay not saying that out loud. So I just want to acknowledge that. And I think it's an important part of mental health because equity and, systemic racism, are an important thing for us to address as a system of care.
Thank you for bringing that up, Erica.
Yeah, thank you.
It's truly, truly, it's both a difficult time and I think a hopeful time, because I really haven't seen in my time on this earth, I haven't seen people come together to address the racism and cultural insensitivity that's out there. And it's unfortunate, truly unfortunate, that we had that example here in the county. And Zoom, became a little bit of a scarier, way to conduct business, that we have to march forward and do it. So
it shows we have work to do as a
we do
collective community. That was, for me, that was absolutely not okay. So it shows that we have a lot of work to do.
Yes. 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 And thank you, Bill, for your response to that, which I know some of us have seen. Okay, thank you, Erica, for bringing that up. I have the Peers Coalition intern report on our agenda. School's not in session, so I'm not sure that we have a peer with us, do we? A representative from the JC. I don't think we do today, do we,
No.
Rhonda?
It doesn't, I don't see Maria.
I don't think she's here.
No.
That's understandable because the
Yes.
James isn't in session, so. Okay, other reports. The PAM committee, the Program Assessment Matrix Committee, which is the committee for doing site visits, I think is, you know, we've made some attempt to move forward, but I think that it's difficult to do site visits with the restrictions that COVID is presenting. So in a way that's on hold. There may be, you know, some steps forward that we can do with virtual visits, but at this point, they haven't happened. We do have a new committee that, a new ad hoc committee that I'm excited about actually, and that is the Jail Mental Health Services. I don't know if it actually has a name, but that's what they're working on, relationship with the jail. And Bob Hales and Carol West are working with NAMI on that committee. So do one of you want to report on what's happening? Bob or Carol?
Well, basically, initially what we did is we developed some screening questions which we want to address. Had about 17, narrowed it down, top 10. And then we scheduled a meeting with the assistant sheriff who's in charge of detention facilities. And ironically, it was just a week. He's just been on the job a week, so we were able to get him. And then the captain and a lieutenant, and then Katie Capedo, I believe it's pronounced. And so we set up a conference call with them, addressed these questions to them, also gave them information concerning the mental health board, and then invited a representative to attend the mental health board meeting in September. But it was a very stimulating discussion, and we acquired a lot of information which I think would be helpful. In particular, there was an issue about the Quality Assurance Committee that the county runs, whether they would participate since they have their own quarterly meeting. And that's something we need to follow up. But I think it was a good first start. And Carol, you want to comment?
Sure. For me, it was just really exciting to have everybody in the same virtual room. I think we started off kind of a little tentative and kind of, you know, the sheriff and his staff were not quite sure what we wanted or why we wanted to communicate with them. But as soon as we started talking about services and care and, you know, collaboration, the communication became quite lively in a very friendly and supportive way. So it felt like we've made our first step. We are looking at other people to speak to, and definitely looking forward to having the opportunity to for the sheriff and his staff to be able to speak to us as a mental health board, but also to speak to the public and to kind of have a first step towards transparency and collaborative communication.
Yeah, and our intent wasn't to have them subjected to an inquisition or feel that way, but it was an emphasis on collaboration, coordination of services. So we tried to keep that in a positive light. And I think they went along with that. And then we're going to have a call with Sid next week, who will provide the behavioral health, I think would be very important, provide the behavioral health perspectives. We've had now the sheriff's perspective, and then the person who, Katie Capedo, who runs mental health program for outside agency, delivers the services in the jail. But now we need to hear from our own people, such as Sid and others. What do they think? What are issues that we should be aware of? And I think by getting that information together, our September board meeting could be really constructive and maybe get some good questions, ideas, and issues on the table.
Yeah, and just a shout out and a thank you to Mary Frances Walsh from NAMI. She's been instrumental in helping us connect with folks that she is familiar with and has worked quite closely with. Yeah.
Yeah, she's great. So that's basically, in a nutshell, what we've been doing.
Thank you. And I saw that some of the information on the NAMI website is quite detailed on what you can do if you have somebody who is incarcerated and how you can proceed in that situation. So thank you for the work that you've done with Mary Frances, and I'm really looking forward to hearing in September. So our September meeting will have that at least in part as a focus, and probably that will be the focus of the meeting. So those of you who are interested, that's something to look forward to. Was there a report, any report from the COM board? Sherry, did you have anything to add?
Nothing more than what I gave at the executive board meeting, and that's in the minutes. Sorry, I don't have that in front of me right now either.
And I don't know that I do. I know that both of us attended meetings, and I printed those minutes out, and I don't see them. I'm really good at printing stuff out and then losing it in the pile. So that's what has happened. Oh, I know mine was, the one that I had attended was just on what the role of a county mental health board was. And I was actually surprised to hear there are counties where the board members are not allowed to visit a site, which
yeah,
I thought was interesting.
Yeah.
And we were held up as an example of a county that had at least approached the thought. Not that we're making that many visits, but we have done them and done them successfully. So, and we will again once we're able to actually go to see somebody.
Well, I know the minutes from the meetings are on the website, on the COM board website. So I encourage everybody to keep informed that way as well, because it is, as I've mentioned before, it's a wealth of information and many links to other information as well. And they, on the website, I know they do keep us informed as to what's happening in Sacramento with the legislators too, concerning mental health services and budget stuff and all of that. And it's good and important information for us as board members to have.
Yes, it's a good source of information.
Also, I think the one benefit is that the information or questions we ask are all laid out, and we send a copy before we visit to the agency which we're going to visit, and then after the fact we send them a copy of our report. But then by having a standardized form when we visit other agencies, we're going to get similar information, and we could compare how other people are doing things too and learn from that experience.
Yes. I think that our procedure is well developed and the questions were good and easy to follow. And the visits that we have done, we've been very impressed with the programs that we've seen. I think that if there were issues that came up, that they would come up in the midst of, positives. There's room for both in the observations. So I think it's a well-balanced process that we have. Okay, any other reports on, I don't think that there are other reports that I'm looking for. So there is no meeting in August. Oh, there is one other report that I should mention. I've been working hard on getting our annual report for 2019, 2020 done, and it's in the process of being reviewed by other board members, and I'm not sure what the process is for the final approval of it, but it's basically done, except for the one thing that I'm going to add that wasn't in the last annual report is a short bio on the board members, because I think the Board of Supervisors know who they have appointed to the Mental Health Board, but I think that it would be helpful to them and to the community to know, what the makeup of the board is, and what the where people who are on the board, why they have come to the board, and what they have to contribute. So that part I'll be working on. We're supposed to be presenting now to the Board of Supervisors at their first meeting in September. We have been on the agenda and been moved forward now all year. That date that is set is actually to present last year's annual report, but I think that both of them will be ready by then to present. So if you're a board member and you haven't put together a little bio for me, and I'd like to include a picture if you're willing. So if you have a headshot that you could send to me, you can email it to me, and then I can include that information for the Board of Supervisors so that they have literally a picture of who is on the board and why they're there, and what their attributes are, what their strengths are that they're bringing to the board. And there are many. I'm very happy with the qualifications and the makeup of the board currently. That District 3 vacancy, we are really looking for another peer voice. We're strong with community members, and we're good with family members now, but we don't have quite enough peer voice on the board, and we only have one vacancy. So that one vacancy really should be a peer. It's in District 3, which is Shirley Zane's district. So hopefully that will happen soon.
You have a question, Kathy?
Yes.
I guess two things. One, since there will be a change of supervisors for that district, perhaps the incoming one after the first of the year may have some input as well to contribute. That's just a thought. But on in September, what will the presentation of the annual reports look like? It's going to be virtual, I'm presuming. How will that go?
I honestly don't know. Bill, I don't know. Do you have any idea?
No, I don't.
I don't know. I know that we have sent to the Board of Supervisors last year's annual report, and hopefully they have all gotten it. I'll be sure to resubmit it so that they that I know that they have it. And I will be submitting this year's report, which I have, I sent to Rhonda, and I think that she has put out for comment. So I really don't know.
This is Carol. I'm wondering if there'd be an opportunity for a brief presentation to the mental health board ourselves prior to the to the Board of Supervisors presentation.
I am thinking that our executive committee meeting is probably going to be after the date that they have given us. But if history, you know, is any indicator, my guess is that the date will again be put forward. And so I'll definitely bring it to the executive committee. And I could just present last year's report to the board if we do get the chance to present on the their first Tuesday, and request another date to present after the board, you know, after the our mental health board has seen the report. However, if they go ahead and give us audience, that's one reason that I've completed the report now and put it out so that people could comment on it. So I can talk to you, Carol, about that and, you know, make a decision, but I would be presenting it in a draft form to them.
I have a question for Rhonda about a possible presentation. Is it, perhaps you could explore whether it's possible to kind of group, if the mental health board showed up virtually at a Board of Supervisors meeting, could they be segregated as a group and come up on the screen as a separate collective group so that the board might see the faces on screen as a group, you know, adjacent pictures. If you don't know, maybe that's not, you might be able to explore.
So Bill is the only person that I know that goes to a Board of Supervisors meeting. I've never been, I've never presented. I've only sat there and waited my turn, you know, with a group. So Bill, I don't know when something is on the agenda with the Board of Supes, how that looks. How do you work out timing? How do you know? So that would help at least the board know.
Yeah, so who is the board liaison for us?
You.
But on the board side.
Shirley Zane is the liaison.
Technically,
well, apparently.
yes. There's really no one, but yes. Shirley, she's the mental health person, yes.
There's a staff person on the board side who works with the board to establish the agenda, and I think the mental health board can ask to present briefly.
So I have a comment. Since Mr. Gore seems to be in our corner, maybe we could ask him to proceed, either asking Shirley Zane or himself to be the person to represent us.
One of the suggestions that came up was to invite a different board member to each meeting. So the September board member might be the supervisor for District 1, and then the next month, or District 2 representative. So we could have information from each of them, and then also they'll get more information from us and more knowledge. But rather than just one, depending on one person who either comes or doesn't, and usually doesn't, but having each one present briefly, invited. We talked about that. I thought it was a good idea.
Yeah, I think, Bob, maybe at the executive board meeting, we could talk about sending a letter to the Board of Supervisors, and since there's going to be a transition of District 3 from Shirley Zane to Chris Corsi, that's looking towards next, does that happen in January? I don't know. That at beginning in January, the Board of Supervisors themselves can come up with who's going to do what month.
I think that's one of the topics that James Gore brought up. I think his suggestion said something about what about having a policy where the supervisors would attend two mental health board meetings a year, and that they would coordinate amongst themselves which ones it would be.
Right. So I think either we need to get in touch with him again, or go ahead and send a letter from us as a board to whoever is the chairperson of the board. I think, is it Mr.? I don't know who the chairperson of the board is.
Gorin?
Yes, Supervisor Gorin.
Okay. So just to follow the protocols and the procedures, but to put the ball in their court so they know that we would like them to represent, but give them the opportunity to say who's going to do what month. But
So
just kind of move it forward.
Yes, and we did talk with him at the last meeting about the fact that Tuesday evenings are the end of a very long day for them because they have their supervisors meetings, and we talked about changing to Wednesday, but I am not willing to change the meeting date if even one of us is not able to make that meeting. And so I would like to ask board members, and I will do it separately, if the third Tuesday does not work for everybody, the third Wednesday, but possibly we could do the second or the fourth Wednesday. So
I know I'm the holdout for the third Wednesday because that's the hospital district board meeting, but I could certainly do any other Wednesday.
So
Yes. We also need to poll the supervisors to see what their schedule is.
Yeah.
Right.
Getting back to the annual report.
Yes.
You sent the draft out to each of us board members, right, for input?
Yes.
Rhonda did.
Yes, oh, right, Rhonda did. So in answer to Carol's question about the report, the draft is out there for us to read.
Have you received it, Carol?
Yes.
Yes, okay. Okay. So no meeting in August of any sort. No executive board meeting and no regular meeting in August. And then in September, we'll have the executive board meeting, and the sheriff the jail presentation will be the focus of our September meeting.
Kathy?
Yes, Becky?
Since we're not meeting in August, I'd like to recognize, acknowledge, and potentially party with Rhonda in her retirement. And I would like to think that we could acknowledge Rhonda somehow prior to her departure. I feel like that's more than appropriate.
Absolutely.
Yes. Well, we'll have to figure that party
We're
out.
all in denial about that.
Yeah.
Like, don't take me out of my little fantasy bubble. No, seriously, we're going to really miss you.
Yeah.
Thank you. I'll miss you guys.
What is the date?
September 25th.
September 25th. And we meet September 15th. So September 15th, we'll have to have the sheriff present and a party for Rhonda.
Okay, COVID, did you hear that?
Yeah.
What I'm wondering is how Bill is going to take Rhonda's job as well as everything else he's doing.
Yeah, I definitely don't think I have the disposition to replace Rhonda.
Yeah, Rhonda, you're certainly going to be missed.
Thank you.
You take care of us very well.
Thank you.
So,
Thanks for bringing that up, Becky.
yes,
Yeah, thanks.
thank you. So I don't have an official report. I want to thank the panelists from West County and the county panelists who were representing West County, and everybody who attended. I think it was a good meeting.
Thank you.
I really like the collaboration and teamwork that I see happening with West County and the county staff, and really nice to see. We were going to have a discussion about racial disparity. I think that we did a little bit of that with Becky's comments and some of the discussion about distance, telemedicine, potentially helping with that. I think that that's a conversation that we have to have more of, and we will, and I'll be sure that it's somehow put into our future agendas to address that. Anybody have anything else they would like to say before we wrap this meeting up? I see, Linnea, you have somebody with you.
Yeah, hi, my husband John joined us. Many of you.
John.
I just want to hang out with all my friends. Hi, everybody.
Okay, anybody else have anything?
I would just like to say thank you for your patience as a new member. I appreciate it. I'm in learning mode.
We've all been there.
Oh,
yes.
Thank you. That's very generous.
Yes, we have. Okay. Not hearing anything else, I'd like a motion to adjourn.
I'll make a
Move that we
motion.
adjourn.
I second it.
I think that was Bob, and
Yes.
somebody seconded it. So the meeting is now adjourned. Thank you, everyone.
Thank you.
Thank you.
Thank you.
Bye.
Bye now.
Bye.
Bye.
I'm leaving.
Good meeting.